Good morning and welcome to another live recording of the Nursing Home Podcast. We are again discussing the COVID vaccine. There's so much information about the COVID vaccine. People are scared of it. People are saying you absolutely must take it. You absolutely must not take it. And we are trying to get to the bottom of this and figure out what is the real deal with the COVID vaccine. We all know the impact that COVID has had on everybody, but specifically the seniors, the devastating impact it's had on senior care facilities and seniors in general. And of course, we want to protect every member of our society as much as possible. So today we will really focus on the safety, the efficacy of the vaccine, and all things like that. If you have any specific questions you want addressed during today's episode, the best way is to go over on LinkedIn or on Facebook where we're streaming this live and leave a comment. And if we can, we'll get to some of those comments. Okay, for today, I would like to welcome to the show Catherine Grube. Catherine is a consultant pharmacist working in the long term care setting. She's been a pharmacist for 8 years, working both the retail and the long term care settings, and was introduced by Sarah Osborne, the Stable Studio manager here in Boston, where we are doing this live podcast. And I'm very happy to have you on the show. Welcome, Catherine.
Thank you for having me.
Yes, we're excited to have the first of all. Okay, so like I said, I want to know a little. I want our listeners and myself, because we literally just met around a minute ago, to learn a little bit about you and your professional career, and specifically about your long-term care experience. So tell us how you got to doing what you're doing today, and then we'll get into the meat.
Sure. So, like you said, I've been a pharmacist for 8 years. I started working in the retail setting after I graduated college. Worked there for about 5 years. Then I transitioned over to long-term care on the dispensing side.
Hmm.
So, working in the pharmacy, sending out medications to the home. And then I got into the consulting side, which is where we do chart reviews. So it's more clinical, where we look at their medication regimens and make recommendations for optimizing therapy.
Got it. So you came into the coffee meetings with
Yeah,
your pie charts and told us what we're doing right and what we're doing wrong.
exactly. That's what we do.
Okay. So that's who you are. You're the pharmacy consultant, and you spend maybe one day a month or 2 months at the nurse's station doing stuff.
Yep.
And
Digging through the
saying,
charts and looking for problems, things to fix, things to optimize, making sure they're monitoring appropriately, all that.
got it. And is that what you're still currently doing? I'm sorry if I missed that.
Yes, yes, it is.
Cool. So if you would be doing this in Massachusetts, were you ever working in Massachusetts?
No, no, I'm not. I'm only in Rhode Island.
Only Rhode Island? All right. So we didn't cross paths. Could have. Okay. So let's go straight to this. So um, there are people saying seniors should not get vaccinated. Seniors are at risk. There's so many contraindications, if I use that word correctly, or there's so many other things that are going on with them. Introducing something that we barely know anything about into their bodies at this point can be a real challenge. Who knows what's in there? Who knows what other effects it could have? What are your thoughts about that?
Well, I mean, you think about it like the flu shot. We encourage seniors to get the flu shot every year because they're really the population that's the most at risk for the serious adverse consequences. So it's really, you have to look at it as a risk versus benefit analysis. What is the risk of, them getting the COVID virus versus getting the vaccine? As we've seen with, the trials and early rollouts of the vaccine, there's not that many if any serious side effects. I mean, there's the risk of anaphylaxis, which there's a risk of that with anything. But for the most part, the side effects are mild versus them getting the COVID virus and being actively infected. Their risk is much, much higher to have a negative outcome, even death from the virus.
So basically, whatever risk that they may have by introducing the vaccine into their bodies pales in comparison to the risk of getting COVID, which is very real.
Very, very real. We've seen it in the homes, the devastation that has occurred from the virus getting in there and infecting the population. So I think it's very important to encourage the vaccine within the nursing homes.
Are there seniors that you would say is that maybe certain ones should not take the vaccine for whatever reason? Or is it just everyone should get vaccinated? End of story.
I mean, you have to look at each person individually. If there is a risk, if they have a history of anaphylaxis, which is a serious allergic reaction, there is a
What
risk.
is that specifically?
So a serious allergic reaction would involve, difficulty breathing, breaking out in hives all over. It could cause the throat to close. Something a reaction like that. If you have a history of those reactions to even something not COVID related, there is a slight increased risk of that reaction happening to the vaccine. So even in those instances, the recommendation is to still give the vaccine, but just to monitor the patient more closely and to have the treatments available in order to
Mhm.
treat the allergic reaction.
Right now, this risk that you're describing right now, is this a risk more with this vaccine versus the flu vaccine or anything else? Or is it for all vaccines?
I think there's always a risk of anaphylaxis with any vaccine because
Okay.
especially if you've never had the vaccine before, you don't know if you're allergic to it. So you don't know if you're allergic to any of the components. Um, they are seeing with this one that it's not necessarily related to the vaccine itself. It's just having that history of allergic reactions to anything. So it's a little bit different than the
Hmm.
flu vaccine. But as long as, the medical professionals giving the vaccine are prepared, they can deal with it appropriately.
Hmm. So another point that people are concerned about is the speed at which this vaccine was developed, and we know that COVID is not even here in the United States for a year, and we already have a vaccine. Other vaccines have taken years or decades to develop until we actually have something. We know that there are studies. We just interviewed someone here yesterday. There are studies that are still ongoing as long-term side effects. Well, why is that not a reason to be concerned, or is it a reason to be concerned?
Well, the thing with the COVID vaccine is it's a different technology than the vaccines that we're used to. So it uses mRNA instead of traditional vaccine development, where they take a portion of the virus and they incubate it and they develop the vaccine from there. That's why that takes so long. But mRNA doesn't work like that. So it doesn't take as long to develop the vaccine.
Okay, what is that to non-pharmacy people? What in the world does all that mean?
so so basically with the flu, they take the virus and they culture it and they develop, you know, something to inject into your body that invokes the response, the immune response, which helps you to build the immunity to the virus. Whereas with the COVID, it's taking what's called a spike protein. So it's introduced into the body, and the cell, the outer layer of the cell starts to develop. It shows, like, can develop that spike, and then it can show the rest of the body, and the cells then start to proliferate and to create that antibody.
Okay, so I don't think I got it fully, but let's try this. So, I mean, a regular flu, just to simplify it, you're taking a little bit of a flu and injecting it into the healthy patient, so the body learns to develop the appropriate response to that, so that if the real flu comes along, it's already the person's immune. Right, that part I got. As far as with COVID, so this is not you're not injecting COVID into the healthy patient,
No,
right?
you are not.
So, what is it that you're doing? One more time, sorry.
So see, I have a chart here in front of me that kind of describes it. So it provides instructions for our cells to make a piece of the spike protein. The spike protein is found on the surface of the virus, but it's not actually the virus. So that's the portion of it, um, and it's given to the patient, and then the once the cell recognizes it, the cell inside the body starts to produce that spike protein, but it's not actually altering the cells at all. It's just introducing that portion that is also present on the coronavirus, so that the body can start to develop an immunity to the virus without actually being exposed to the virus. So it's just basically like a little piece of it, but not the infectious portion of the virus, if that makes any sense.
Kind of. So why wouldn't we do the so the reason why we're not doing the actual virus is because that takes time to develop, or that's the
Yeah,
reason?
it takes a lot of time, and they wouldn't be able. It would be years until they had a vaccine, and they were trying to get. I mean, they had this mRNA technology has been around. They started to develop vaccines towards SARS
Hmm.
with this, but then funding ran dry, so they never completed developing the vaccine for that. So we already had the technology, which is another reason why it could be sped along a little bit more.
Got it. Now, why wouldn't we do this for every vaccine? Well, I mean, in general, right? You speak to the average guy in the street, which is me, and is it, we want to be immune to a certain sickness, no problem. Your concern is that you're going to get the flu. Here's the flu, so now you got it for sure. Now that sounds crazy, but obviously the way it works, not obviously, but the basic way that it works is that, like you said, you're training your body how to react to, I guess, a more mild version of this, so that when a real threat comes, you're ready prepared. I guess like combat training before the war, right?
Yeah.
Something like that. Before you go into battle, something along those lines. Um, but obviously, there's a challenge with doing that because you are injecting something, something minor, but something, uh, I don't know, something negative into your body. So with and it takes forever to develop. So what you're saying, I think, is that with COVID we didn't do that. It takes forever to develop that vaccine, and this can also be effective. So I guess my question is, and again, no, this is not really the topic. I'm just trying to wrap my head around this. So shouldn't every vaccine then be this type of vaccine that we're doing now, as opposed to the one that takes forever to develop and is injecting potentially a more moderate variation of the threat into our bodies?
I don't do the science behind the
Yeah,
vaccines.
no problem.
It's a completely valid point that, something like that should be considered in the future. I'm not sure with different viruses if that capability is even there. Like if
Hmm.
there is, because the coronavirus vaccine relies on that spike protein. I don't know if every virus has that spike protein, if that's even, a possibility. I'm not sure. It's not my
Right. So
area.
I guess really the question is this a brand new thing that was figured out? We're trying to create a COVID vaccine. When they started initially, they said, we have COVID, we need a vaccine. When they sat down, all these different companies, Moderna and Pfizer and whichever other companies are busy trying to put out their vaccines. Initially, when they started the project, they say, oh my gosh, this is going to take us 7 years. The world is in a bad place right now. And hopefully, this thing disappears because the vaccine is not going to get here in any reasonable amount of time. And then once they were in the lab, they all figured out that, hey, we have a shortcut here. We have a different type of method. Or initially, and again, this is not why you came on. I'm just you're educating me. You're the smarter one than me in the room. So, but or that's not what happened. When they sat down, they knew that it wouldn't even make sense to begin if they had to do a traditional vaccine, but they knew that COVID was unique, that it had this protein spike or whatever that thing is, and that we have an opportunity of combating the virus directly through that. And that's what they set out to do initially. Like, is this earth shattering breaking news in the medical community that we have this new type of vaccine? Or is it no? This is, we knew this, COVID, you could always do this.
So I think in the medical research side, it's not earth-shattering technology because it has been around.
Hmm.
To the regular public, it would be new because it was just in research before, so you wouldn't necessarily hear that as part of the public because you're not involved in the research side of it. But for those scientists involved in the research and development, they would have been aware of this technology for a long time.
Got it. Okay. So the reason why it's important to know that is because for those who are concerned about the risks and about that we ran into this brand new thing, and all of a sudden we're just doing this in millions and millions of doses all over the world. People are injecting themselves with this, brand new technology. You wouldn't just get into a self-driving car and close your eyes just because they said it works, right? Because we're used to driving for years and years. We're not going to let go so quickly. So I don't know if that's the best example, but the point is that if something was like developed so quickly, we might have second thoughts about it. So the point, so if viewers, listeners who are listening right now, and again, we had Dr. G on last episode, pretty much said something similar. Um, this is not something that was rushed. This is not something that was done halfway. this is not something that's new. This is something that existed, and this is something that there's a tweak to it. There's, again, oversimplifying it. I'm not claiming to be the clinician here, but the fact that it was rushed is not a risk to the one who's taking the vaccine. I think that's very important for everyone to realize, and that they should be okay with injecting themselves with the vaccine. And the risk of taking the vaccine and whatever else, whatever complications, are much lower than actually getting COVID. Um, but let's go right into that. So what about, everyone's nervous about side effects? People are saying that since it's new, which we just, you just explained that maybe not as new as we think it is. You never know. 6 months down the road, every single person who took the Pfizer vaccine may end up with a third arm.
I mean, if you think about it, with any drug or vaccine that comes on the market, we don't know long term efficacy. We don't know long term adverse events that occur until they occur. So even, a new drug that comes on the market, they continue doing post market surveying where it's almost like a phase 4 trial where they keep an eye on long term side effects that they maybe didn't know about when they did the original development of the drug. So
Hmm.
there is always a risk with any new drug, any new vaccine that comes to market, that there's going to be some long-term effect that wasn't seen in the development. So yes, there is a risk. I don't think there's a risk of developing a third arm, but there is always a risk of, something happening in the long term that we don't know about right now.
Hmm. Right. But based on best clinical practices that are used across all vaccines, all medications, there are systems in place. Nothing is guaranteed, but there are systems in place that tell us when something is effective, when something is dangerous, something is considered to be safe. And this meets the threshold of being considered safe, the ones that are approved, so that they don't have to be concerned about long term problems, even though it's true you can't prove it, which is something I've heard from a lot of people. Right now it's good and everyone's lining up and everybody's getting it. How do you know what's going to be in a year from now, in a month, 2 years from now, 10 years from now? The answer is nothing. You don't know. There's a lot of things that could happen in a year that are much greater risks than a side effect of the COVID vaccine that has gone through all the stages that are necessary to get it approved. But what about the actual side effects? Not or symptoms, whatever it's called. But when you take any vaccine, like, are there any other types of side effects that are expected and normal? And what is the experience? Were you vaccinated, by the way?
Yes, I got my first dose
Yeah.
of the vaccine on Monday.
So let's talk about that. Which vaccine did you get?
I got the Moderna.
You got the Moderna, okay. And how did you get the vaccine?
So I'm in one of the first groups to get the vaccine because of my exposure in the long term care facility. So I went
Mhm,
to a clinic and had the vaccine given to me there. And the only side effect I had was a sore arm for a couple of days. I never got a fever. I never had, I wasn't tired, didn't get a headache, nothing like that. I just had a sore arm, basically the same as getting the flu shot, just a sore
mhm,
arm. There are some people that do get, fever, malaise, which is feeling extra tired. You can get a headache, you can get chills, but that's a normal immune response because it's your body's way of developing the immunity to the virus. So by your immune system kicking into gear, those side effects are completely normal.
mhm. Like all good parents say, if it hurts, it means it's working, right?
Yeah. Yeah,
So,
it's the same thing with the flu shot. I mean, you can't get the virus from the vaccine, same as you
mhm,
can't get the flu from the flu shot. It's flu-like symptoms, which is a normal immune response.
mhm, mhm. Got it, got it. But that is to be expected, right? So if someone's going to take it, just like any other vaccine, this is something that they can have. Okay, so let's just get this straight. Um, in regards to the vaccines. So we're saying the vaccines, they pass the regular rigid tests. They are considered to be 100% safe. No, we don't know for sure what's going to be in the future. Mild, low grade fever, mild symptoms, body ache, not body ache, chills, things like that are normal for this and for any other vaccine. and hopefully, and it's been proven to, the efficacy has been great. Was there a story recently of one of the vaccines? I think I saw one of the vaccines where someone got COVID even after getting the vaccine.
So they did, but the thing is, we don't know the incubation period when you get exposed to the virus. It varies. So I believe that person developed symptoms 9 days after they got the vaccine, but the incubation period for the virus can be anywhere from 3 to 14 days. So what would have happened? He did not get COVID from the vaccine because that it's not how it works. You can't get
Hmm.
COVID from the vaccine. So he would have been either exposed before he got the vaccine or right around the time that he got it. And it's important to note, too, that the first dose of the vaccine does not provide you all of the coverage. You need to go back and get the second dose for your body to do the full immunity, because the first dose is basically it's priming your body for it, and then you get the second dose, and that's where the full response really kicks in.
So has there been anyone that you're aware of that went through the whole system, two doses, they waited until everything was done, and then they still got COVID?
Well, the vaccine just rolled out, so there hasn't been enough time for the second dose, because for the two vaccines that are out, it's either 21 days or 28 days between the doses, and they just started. I believe it was last week is when they first started. I don't know with the trials, because the trials are blinded, so the people participating in it don't know if they got the vaccine or not. So
Hmm.
that would be a separate thing. But in terms of the actual vaccine rolling out to the public, they just started, so there's no evidence of that yet.
Got it. Let's move to another subject. I just see that we have some time, and something that we spoke about. Through isolation for seniors is always a challenge. Isolation for anybody is a challenge. Solitary confinement was not a privilege; it was a punishment. So, seniors in living in a nursing home, and assisted living, in any other communal healthcare setting, and any other setting like that, with even without COVID, is a very isolated experience. Of course, the providers do everything in their ability to try and bring in outside entertainers, outside visitors, or whatever they can, or even just engaging with each other, so that there can be some semblance of normalcy. Right, we're social creatures, and it's not a luxury. It's a necessity for our mental health, spiritual health, or health. Period. So with COVID and no visitors, and very few people coming in and out of the building, besides there were some brave souls like yourself, and thank you for that. What is what have you seen? What are your thoughts on this? What have you seen, and maybe some possible solutions for other operators or seniors, people who have loved ones at home by themselves? What are your thoughts on this?
So, yeah, we definitely do see a difference, especially in the patients in these nursing homes that have dementia. With they already are confused, and their whole routine has been thrown to the wind, because their families, a lot of these families are in every day visiting them, giving them a reminder that they're there, and then all of a sudden they're alone in a room, and
Hmm.
they have no idea why. They can't comprehend why. I watched, the nurses and the CNAs in the homes trying to convince people with dementia to wear a mask, and they don't understand. They don't understand why. They don't know how to wear it. It's just, you know, seeing that, and you do see a decline in people who are not engaged as much. So if they don't get the activities that they used to get, because they're trying to keep their main goal right now is to keep these people safe and to keep them alive. And being alive, like you said, being alive versus thriving, it's very different. And um you do see a decline with the lack of activity, but these homes have done a very good job at trying to change what they do to incorporate some sort of activity. So they're doing a lot of FaceTime with family, so they can still see their family and talk to them. They do outdoor visits when it's allowed, or window visits where they can talk to their family through the window, and that really helps. And the staff there, while they're getting burnt out, and they for sure are getting burnt out, they've stepped up a lot to help our seniors through this crisis, and not just survive, but attempt to thrive again.
Yeah, I mean, it's the challenge is huge. That the when you talk from a staffing standpoint, because many of these nurses and nurses aides have been pushed way beyond the limit pre-COVID. In every facility across the country, the compensation is so slim and profit margins are so slim if they exist at all. I know there are all sorts of stats of the amount of money a nursing home loses per day that it cares for a Medicaid patient, which is usually the bulk of their patients. So obviously, the staffing is nothing close to what you would see in other healthcare settings. And add to that they're working more shifts, than usual. Hopefully within the legal limits, but sometimes not because it's just a matter of life and death. And all the extra stresses these, the nurses or the CNAs really, I really need to get some of those so that people should understand what it's really like, the selflessness that they have, and including yourself. Going there, the typical American citizen. I just talk from the perspective of our country right here. Most people. I don't want to say general statements, but lots of us are sitting at home, working remotely, doing Zoom or whatever it is, similar to what I'm doing right now. Um, Staying away from society if possible. The brave one in the family is making the trek out to the grocery sometimes. The car doesn't need to be filled with gas because they're not going anywhere. Slippers are considered to be formal, and it's a different life. Whereas the healthcare workers are not getting paid millions of dollars. A lot of them are getting paid similar wages to the people working in fast food chains and whatever else they're doing. They're working themselves to the bone, physical labor. It's always challenging situation. The resources are limited, and add to that they have to try and protect the residents from themselves, like you just described. I'm just picturing the scene of trying to put a mask on a resident with end stage dementia who barely even knows that you're there, let alone that you're trying to put on a mask. And what are the chances that that mask is staying on? And what happens if that person is positive with COVID, as I'm sure has happened many, many times, and they're not going to stay in their room because they're physically able to move around, and you can't lock them in their room. Well, what exactly are you doing? It's a very, very tough situation. It's not the burnout is not just because they're working physically hard. It's very emotionally draining. You develop relationships with the residents, which usually is a good thing, except when they're taken out the back door, which is happen. Unfortunately, happens all the time. I'm ranting here a little bit, but and I'm just reminded scenes of when we lost residents, even just from a regular flu when everyone's vaccinated. Sometimes you can lose a number of residents in a regular winter, even if you did everything correctly, and trying to close all the doors and the resident gets whisked out so that they don't further decrease the morale in the building. And this is the environment, many times underappreciated. It's possible that their management is equally overwhelmed with their challenges, and throw the media into the mix, add Department of Public Health holding you accountable for rules that were barely rolled out and barely understood and not based on, again, hopefully they're doing the best that they can do also. But then CMS on top of that and giving conflicting requirements, which happens all the time, especially now in COVID. I speak to any operators, I'm talking from the administrator level and up, but or should we do this or should we do that? And you're damned either way. Right? So it's a problem. It's a real problem. And so my point of all this, besides for trying to give everyone a little bit of an understanding of what it must be like, is to understand that for the let's say an aide at 8 o'clock at night that is ready to do a double and is on tomorrow for a double, and has seen two residents go this week, and now there's one resident that's feeling a little lonely in her 14 residents that she's supposed to be caring for during that shift, to take them a moment to try and help her connect with a family member through Zoom or FaceTime, or even to stop and talk to the resident for a minute before she's running to answer the other call out lights that are all being beeping and flashing. It takes real selflessness. It takes this is the from a Jewish standpoint, there's something called a true kindness, and the typical example is the respect that we show for someone who's already dead, in the way we bury them and the way we talk about them, and everything that we do. And the reason why I give that example is because there's absolutely no ulterior motives in what you're doing other than genuine, selfless, caring and dedication, without any idea, without any means or notion of getting anything back. This is very, very close to that, if not the same thing. Especially if you're talking about a resident who has no family members. All right, end rant.
I
uh,
think you're absolutely right. I see it. I see it in the homes with these nurses and these aides who genuinely care about these people like their family. And it's heartbreaking. It's heartbreaking seeing what they go through and hearing what they go through. But I do appreciate every single one of them and all the hard work that they put in.
So at least you do, because many of the residents sometimes don't or won't or can't, appreciate that. Sometimes the higher ups, don't or won't or can't, all the same thing. Not that they don't realize it, and some of them do a good job at expressing it. But the healthcare heroes has become, I think the term has been abused a little bit. Everybody's a healthcare hero, and you went to the supermarket, so you're a healthcare hero because you keep your family alive, and you did. And it's just been thrown around so much that we don't realize that there are some people who are really giving up everything for this, and let alone a lot of these can be single parents going home to a small living quarter with other small children or older parents themselves. They could be a sandwich generation where they're taking care of their parents or in-laws in their homes, and they have small children, and they're working another job, and then they have to try to make sure that they're not bringing whatever they were exposed to into the house. Really caring. I'll add one more thing: the cultural difference. Many of our nurses or aides who are working in long-term care are not, many of them are first generation Americans. Many of them, at least, yeah, many of them, it's just the way it is. And it's not like they share a common culture with the people that they are caring for. This is just coming from human, is really love and concern and care, which is why they do it. They could literally. Sometimes I would wonder, like, why are you doing this? You could work down the block, at a McDonald's, and you can make the same money or pretty much the same thing with very little risk. If you burn a hamburger, nobody goes to the emergency room, right? If you do it like the worst case scenario, maybe you could lose your job. You're extremely limited. Like, why would you do this? And the answer only is because this is what they care. This is what's natural for them. Yikes. Okay. I went down a rabbit hole there. But I guess the point is for isolation. What else? So we've seen FaceTime, we've seen the visits. Anything unique that you've seen just in your going in and out of facilities? Anyone's done anything really interesting to deal with this problem? And then I see what's getting late. We're gonna have to wrap up.
Um, I mean, I've seen a lot of the same, the Zoom meetings. They do window visits with the residents. They do different activities where they do. Oh, one thing is hallway bingo. They do sometimes where, if they're in a lockdown, they'll bring the residents to the doors of their rooms and they'll play bingo in the hallway so they can still, see each other and
Mhm.
play, but they're still, safely separated from each other. Something like that has been really neat to see.
Wow. Wow. Fantastic. Well, Catherine, thank you very much for coming on the Nursing Home Podcast. Thank you for what you're doing. Um, you're definitely earned the title of healthcare hero. Really going in and coming out and going facility to facility, doing what you're doing. So thank you for that. Thank you for the information about the vaccine and also understanding the setting and the environment in which our seniors, some of our seniors, are living. Any final thoughts you'd like to share with our listeners before we let you go today?
Thank you so much for having me. Just if you can spare, if you have any donations you can bring to nursing homes, whether it's activities, extra tablets you have at home so they can use these for the FaceTimes, anything that can lift the residents' spirits will really help. Anything like that. I They would appreciate it, and I would appreciate any kind thoughts and donations you have for these facilities.
Okay. So Amazing. So if you're thinking, what can I do? Assuming you're listening to our conversation and you're moved, and you're like, wow, look what these people are doing. I'm sitting at home binge watching Netflix, and you have people in here who are risking their lives, and that's probably where you should be. But you want to know, how can you get involved? Call your local nursing home, call your local assisted living facility, and tell them, what do you need? What can we bring you? Maybe they'll say a round of Dunkin' Donuts for the staff. Maybe they'll say we need, a tablet. Maybe they'll say even just come by, with your family and knock on the window to a couple of rooms. Maybe write some get well cards or just thinking of you. These are small things that don't have to cost you anything other than a little time and a little caring, and they can go a very long way. Well, thank you, Catherine. That was a very interesting suggestion. Not expecting that, but we had someone on the podcast who has done this with his family. Eric Harder, give a shout out to him. His wife actually started this with her kids, and they were writing cards to their local nursing home. But then they decided there's an app, the neighbor next door. I forgot what it's called. There's an app which connects neighborhoods with each other. I'm sure maybe one of the listeners will know. And she just posted, this is what I'm doing. She left a box outside for other people to participate. She got well over 1,000 cards that she went afterwards and delivered it, to the local nursing home. And obviously they were ecstatic with it. So these are little small things that, instead of just saying we can't do anything, there's what we can do. Thank you so much. I really appreciate your time today.
Thank you for having me.